Medical Tourism Corporation interview with Dr. Sajan K. Hegde, spinal surgeon, India. Dr. Hegde has extensive training and experience in India and Europe. He is a pioneer in spinal disc replacement surgery in India and also has designed, in collaboration with Medtronic Sophomore Danik, a comprehensive spinal instrumentation system for anterior fixation in a variety of spinal problems.
I'm Dr. Sajan Hedge. I have been here now for a little over 10 years, and I've been the spinal specialist here. And after my training in India, I did my specialized training through fellowships with some really big names, most of them in Europe, in France in particular, and Germany, and Switzerland. And I was trained in the basics as well as in more complex situations in spinal surgery. After completing my training, I came back and I started off in another hospital where I was a spine specialist. I introduced some of the newer techniques that I had picked up during my fellowship training. And essentially what we offer now is the full range of spinal surgical applications, right from the minimal invasive to complex spinal reconstruction, for example in deformity, failed back situations where patients have been operated multiple times. The big bulk of our practice is lower back, degenerative, that is adult, and then the next segment is deformities in children. We are perhaps the biggest center in the private sector dealing with spinal deformities. The first fellowship that I did was what is called as a Cottrell Fellowship. In fact, I was the first Indian to go on this Cottrell Divisive Fellowship. And this fellowship 10 years back was much sought after. I did my fellowship with a gentleman called Dr. Daniel Chopin, who was the chief of spinal surgery at a hospital called as Institut Callot in a place, in a remote village in Normandy, which is the northwestern part of France, by the beach, by the seaside. And this hospital was like the magnet for everyone with spinal problems from Africa, from the Eastern Europe, and people used to come from far off places. So, and also a lot of people used to come for training. And I spent a full year with Dr. Daniel Chopin. Subsequently, my training was with another very, very well-known surgeon, a gentleman called Professor Jürgen Harms, who heads the Spine Institute in Karlsbad, Langensteinbach in Germany. That's somewhere near Karlsruhe. And again, very, very big spine center, very well known. And of course, I have been with other well-known surgeons for 3 months, shorter periods, and both on the eastern side as well, with surgeons in Japan. Professor Kaneda, who was a very well-known surgeon, perhaps now retired. I have been developing doing innovations in spinal surgery, developing newer implants, particularly for use in patients with spinal injuries or with spinal tumors or even with infections. These devices give us better ability to fix the spine and reconstruct the spine, particularly in these situations. And I was developing with Medtronic, and now I'm doing it with a company called Globus Medical, which is based out of Philadelphia. But we were, yes, the first to do the lumbar disc replacement in the subcontinent. And besides that, we are one of the first institutions to use the metal, a new type of metal alloy implant, which is which is called shape memory alloy implant. And this has been used in very, very few centers in the US and maybe just a center or two in Europe. So we were one of the first to use it, perhaps the first in Asia.
What's the benefit of that?
This was used for a very young child, 6 or 7 years old. She had this severe deformity, and the idea of using these shape memory alloy staples is to control the deformity as the child grows up and let her grow in a more, her or him, in a more normal fashion. We have had a steady stream of patients from Europe and from North America. We have had a big number of patients coming from Canada. Most of them have come for after they have had an index operation in the US which has failed or which has given way, and the patients have had recurrent back pain or leg symptoms or symptoms in the arm, and they have not responded to non-operative treatment, and they have not got, they haven't found it that easy to find a doctor to do the revision surgery, sort of. They have come here hoping that their problem is solved, and which we have been able to do that for them. I think they are on par, or just as good, because we do not compromise on the type of implant we use. All the implants that we use are all FDA approved. So none of them is locally made. So we are able to give the same kind of results, as good as the best spine centers in the US or in Europe.
Medical Tourism Corporation facilitates affordable medical treatment at world-class international hospitals. Fill out the estimate request form on our site for a free quote and more information.